Just remember that if someone's drinking a lot heavily for a long period of time, if they abruptly discontinue drinking, they can develop something known as delirium tremens, which can lead to seizures, extreme discomfort. So you want to usually give these patients a medication, commonly a benzodiazepine, usually Librium. I believe we saw it in one of the earlier episodes.
So like a half gallon?
Oh, hell no, just a quart.
But one of the effects that drinking has that most people don't think about is not just on your liver, but on your heart. Alcohol can predispose you to cardiomyopathy, where your heart becomes weak and is not able to function properly. And as a result, you can destroy your heart from drinking too much.
Old man coming in with a heart rate of 30. Sounds like pacemaker failure.
Oh, pacemaker failure is interesting because generally pacemakers are put in for someone who has bradycardia. Bradycardia is when you have a slow heart rate, because the way that I remember that is Tom Brady. Tom Brady is slow, so bradycardia. There's a condition called heart block, which can cause actually pauses in your heartbeat. This is an electrical abnormality that by putting in a pacemaker, which usually sits externally with leads or wires going into the chambers of the heart, that send an electrical signal in order for your heart to beat. And usually this is done through what we call demand pacing, so that if your heart's beating normally, it's fine, but if it senses the heart is pausing so that you don't syncopize and faint, it actually sends an electrical signal to remind your heart to beat. And you'll actually see that representative on someone when you get an EKG. You see these specific lines representing pace capture. If the pacemaker seems not to be working, we do something called a pacemaker interrogation, where we actually see what the pacemaker is reading and what signals that it's putting out. Obviously, you could do external pacing, but that's usually temporary until the pacemaker itself is corrected. And usually when we are able to control a pacemaker, it's done with the rep of the brand of the pacemaker. So we actually have to call the company and have them send someone out. Sometimes we have even a magnet device that we can put over the pacemaker in order to activate or deactivate it. A digital block, that means they're gonna numb up the nerve from all sides of the lower portion of the finger in order to create no sensation distally from that point on.
Any drug allergies, sir? 2 grams of cefazolin.
They're trying to put an antibiotic on board as well because it's likely an infected wound.
Ooh, wow.
Oh, okay. I was looking at a different part. Wow. Okay. So we're missing the complete distal portion of the... When you have heart block, you can have different degrees of heart block. You have to distinguish which type it is because your intervention is going to be different depending on which type of heart block it is. Now, if a patient already has a pacemaker, odds are that it was probably 2 or 3 heart block because he needed this type of intervention. With one, you rarely are getting pacemakers, especially if you're asymptomatic. Now, in a situation like this, they're gonna have to fix the leads or fix the pacemaker, and I guess they kind of are. With a drowning victim though, obviously they're in a hospital situation already, but if there is a drowning victim that let's say you find at the beach, you would immediately do chest compressions and rescue breaths because in a situation like that, you don't know how long the person's been out, and likely they don't have any oxygen in their lungs to perfuse their blood. So in a situation like that, again, 2 breaths, chest compressions, chest compressions, chest compressions. Every time, this is even like some mistake I sort of made in one of the other reviews when they're deciding what to do as mandatory reporters. Like if there is signs of something going on, you don't just brush it off and say no big deal. You have to investigate, you have to report to the authorities. In a situation like this, you should feel comfortable going to a superior and explaining yourself. The one point that she did a good job finding here is that there was no fever. If you're having spontaneous bacterial peritonitis, this is a bacterial infection that makes you sick very fast. So in a situation like that, you experience a very high white count and a very high fever, or at least a fever. And she didn't have that, so good thinking outside the box.
My mercury level is 94.
That's high enough to cause all your symptoms.
See, this is why I don't know what happened with Robbie, that he was fighting ordering this panel. It seemed a very reasonable thing to do.
From a stupid face cream.
Face cream, supplements, all things that are untested and are coming from other countries especially, you have to be suspicious of, which is why, unless it's very clearly proven, manufactured in a really good quality facility, usually pharmaceutical grade, I try to stay away from it.
We're gonna start chelation therapy. It's a medication that binds with the mercury and helps your body excrete it.
Chelation therapy in this situation is obviously indicated, but people will do chelation therapy as a form of scams, basically doing it for everybody, irrespective of what their levels are, sometimes not even checking their levels, just saying that we all have high levels and you should all be checked. It's really become a scammy thing because if you scare a patient, you say, oh, there are heavy metals in your blood, I'm gonna get them out. It sounds to a regular person like you're doing something positive, but if you're doing it without an indication, I don't understand if this is a boss, if this is a loving relationship, an abusive relationship. See, what I would do as a doctor, because I like my little strategies, is I would step out of the room, pretend like I got paged or something, leave, ask my social worker to come talk to the patient. But I would have the social worker wait until I asked to speak to the boss. And then the boss would come with me and I would ask them to talk, and they would love to talk because they want to talk to the doctor. And then while you're talking with the doctor, you're having a social worker talk to the patient.